Hi everyone, my name is Stephany Flores, and the title of my senior honors project is More is More or Less is More, Influence of Training Duration on Learning Noise for Coded Speech. My mentor is Dr. Julia Druin, and before I begin, I just want to thank my mentor for agreeing to do this project with me and for your endless support and for inspiring me to do this project. So getting started, I want to discuss the clinical challenge that is essentially driving my study. So cochlear implant users demonstrate a lot of variability in terms of adjusting to their devices and in their speech perception outcomes. When I refer to the term speech perception, I'm referring to the process by which individuals are able to listen to language and they're able to hear it, understand it, and interpret it. When I use the term cochlear implant, I'm referring to the surgically implanted medical device that helps individuals interpret new signals via electronic stimulation. Cochlear implants are presented as an option when an individual presents with a high degree of hearing loss. Some cochlear implant users are able to adjust to their device quickly and thus are able to produce high speech comprehension outcomes, while others are not. A solution to this variability is using auditory training. Auditory training refers to the oral rehabilitation process that is implemented by hearing professionals in order to help individuals adjust to the new signals that their brain is receiving. The problem with this solution is that we don't know how much training to provide. A way to test the effectiveness of auditory training is by using noise-recorded speech. Noise-recorded speech is thought to simulate what a cochlear implant user hears. So I'm actually going to present an example for you. If you heard a bicycle has two wheels, then you're correct. I know at first it might seem like the signal is too robotic or too degraded to understand, but with training, you'll get better and you'll be able to recognize the speech within this auditory signal. What you just experienced right now is a form of auditory training. And if I were to present this degraded signal one more time, you'll have an easier time recognizing the keywords, if not the whole phrase. And this would be referred as the pop-out effect that you get from training. Previous research regarding this topic has found that auditory training is an effective method at improving degraded speech comprehension. Repeated exposure to auditory training or noise-recorded speech improves a listener's ability to improve their speech recognition skills, and normal hearing listeners usually require a period of training in order to see improvements in their adaptation to noise-recorded speech. Other researchers have focused on looking deeper into the factors that are driving these improvements. One of those factors is top-down training or top-down processing. This process refers to the idea that listeners should focus on the bigger picture or the whole structure in order to improve their speech comprehension skills. Top-down training allows listeners to hear a degraded signal with sentence context. Other researchers have focused on defining the optimal training parameters that lead to the most beneficial gains, and some researchers have suggested that moderate auditory training can provide beneficial gains for cochlear implant users, but intensive training programs might result in better and more consistent results. So studies vary in terms of how much training is provided, and it's currently unknown how much training is necessary to secure gains. So despite the clinical relevance, there's a lot of open-ended questions remaining regarding this topic. And that brings me to my research question. So my research question is, how much training is needed to maximize speech comprehension benefits? And that led us to two hypotheses. The first one is more hypothesis. This refers to the idea that the training group with the most amount of training will show the greatest benefit. So we split our participants into 3 training groups, and they all got a different amount of training. And we predicted that the group that was receiving the most practice, the most exposure, and essentially the most drills would outperform the other 2 groups. We knew that there was also the probability or the chance that less is more would occur, so that all of the training groups would perform comparably regardless of how long their training program was. So we predicted that at a certain point, all 3 training groups might actually end up plateauing, or we would see the plateau effect. So to test our hypotheses, we designed a study that had 3 phases: a pre-test, a training, and a post-test. And we recruited about 90 participants, and they were split into 3 groups, which consisted of 20 to 30 participants per group. For the pretest, regardless of what group you were in, you all received the same stimuli and procedures. So you were presented with a noise-recorded sentence, and then you were asked, what did the talker say, or what did you hear? And then you were asked to transcribe the sentence that you just heard. In this phase, our listeners were presented with 3 different types of sentences: high predictability, low predictability, and anomalous sentences. High predictability sentences contain semantically correlated information that makes it easier to anticipate the words within the sentence, and especially the last word. An example would be Eve was made from Adam's rib. For these types of sentences, we expect our listeners to be able to use context to predict the noise-recorded speech. On the other hand, low predictability sentences contain context that is not meaningful, which makes it harder to anticipate the words within that sentence. An example would be, she hopes Jane called about the calf. And lastly, there's the anomalous sentences, which are atypical sentences. These sentences contain words that don't go together. There's no semantic correlation, but syntactically, they're correct. So an example would be, the arm is ready on the bench. For our training phase, our participants were broken up into 3 groups: a short, medium, and long. Our short training group received 80 sentences, our medium group received 160 sentences, and our long group received a total of 240 sentences. In the training phase, instead of receiving a sentence and being asked to transcribe, our participants were presented with a sentence and then presented with 2 options. So it was like a multiple choice task, and they were asked to select which of the 2 sentences they had just heard. In our post-test phase, it was the same format as a pre-test. So they heard a sentence and they were asked to transcribe. A notable difference between all 3 phases is that in training, we heard low predictability sentences and high predictability sentences. These are considered our trained sentences. And in the testing phase, we heard a 3rd sentence, which was our anomalous sentences. And these were used to determine the effect of training and to eliminate the chance that our participants were just memorizing the answers to these sentences. An example of what our participants saw in the training phase would be what's presented here on the screen, so that we gave them a sentence and then we asked them which of the 2 sentences did they just hear. So I'm going to actually play it for you. If you heard he rode off in a cloud of dust, then you're correct. And our participants in the training phase received feedback, and they were even given a progress bar at the bottom of their screen so they could see how far they had progressed. And our participants in the testing phase did not receive any feedback. The purpose of our training phase was to present our participants with different amounts of training duration so that we could see which of the 3 led to the most beneficial gains. And we knew that exposure and constant practice was the key to improvement and the key to adapting to noise-recorded speech and improving your speech recognition skills. In terms of results, our training group, we created a graph, and on the x-axis, you'll see item type, and on the y-axis, you'll see proportion correct or accuracy. What you can see here is that all of our participants during the training phase performed really well, considering we're starting from 90% or higher, and all 3 groups are performing at ceiling or near ceiling. All 3 groups, as you can see, are performing comparably, and they're performing around the same range. None of the groups are really outperforming one another, and there's not a reliable difference in terms of performance between low predictability and high predictability sentences. So there's not really a difference in performance, which is surprising considering high predictability sentences carry meaningful context. So it should be easier to recognize these sentences, but it's not. But it's not being shown here in the results. In terms of looking at the results from our testing phase, we have our pre-test and post-test here, and we have on the x-axis low predictability sentences versus high predictability, and on the y-axis we have proportion correct. As you can see here, again, on the pretest, all 3 groups are performing around the same level, and none of the groups are outperforming one another. And when you compare pretest to post-test, there's evidence that there was improvement. So all 3 groups improved in terms of their accuracy from pretest to post-test. The magnitude of improvement was the same across all training groups. So what I mean by this is that all 3 groups are improving equally. And again, there's not a significant difference between low predictability sentences and high predictability sentences in the pretest or the post-test. In terms of results for our novel sentences, so these were our anomalous sentences. That's on the x-axis and proportion correct is on our y-axis. What you can see is that at pretest, all three groups are performing around the same range again, and there is clear evidence that they improved from pretest to post-test. So all training groups improved significantly from pretest to post-test, and the magnitude of improvement was the same across all three groups. So again, all three groups are improving. None of them are really outperforming one another. What this means is that short training was just as beneficial as long training or even medium training, and that the long group did not receive an advantage from receiving more training than the other groups. What this also means is that our participants were able to carry over what they learned from the training phase and apply it to the testing phase, considering that during training, they were given a multiple choice task, and during testing, they were asked to transcribe, which is arguably harder. So our results then state that they're consistent with our less is more hypothesis. Improvement was seen across all three training groups, and they were all improving at an equal rate. None of the groups are really outperforming one another, even though one of our hypotheses suggested that we predicted that the long group would outperform the other two, and this did not occur. What this basically means is that the short amount of training can be just as beneficial and produce the same amount of improvement as the people in the long group. And in terms of clinical implications, longer training dosage doesn't necessarily result in better learning outcomes. What I mean by this is that it didn't matter that we essentially tripled the exposure in practice. It's more important to have an auditory training paradigm that is well structured and provides clear feedback. Additionally, training programs and therapy sessions that are well structured can be just as effective. So in terms of applying this to a clinical setting, our audiologists and SLPs have to use their therapy time wisely to make sure that their activity fits within the time they're giving with their patient. So the study is important because it shows that less is more. A short amount of training can be just as impactful and just as important as long as the therapist is able to have a well thought out, well structured training session ready for their student. And our findings lay the foundation for rehabilitation patients adapting to degraded signals. And that's it for me. These are my references. And again, I just want to thank my mentor, Dr. Julia Duran, for being my mentor throughout this process and for helping me and just supporting me along the way. Thank you so much.